Morning, everybody. We're glad that you could come out this morning and join us. My name is Gene Only, by the way, and we're going to be talking about nutritional health today. We have a speaker that has come in, and he's going to be sharing with you what nutritional health means, the degenerative diseases that we're all fighting with, and how we can cope and fight off the degenerative diseases. I'd like to introduce Dr. Kaler. Dr. Kaler is a doctor from the Rockford area. He is a board certified in 2 medical specialties, has 6 clinics, 225 employees, and is well esteemed in this area and is very knowledgeable and has become very passionate about nutritional health. So let's give him a warm welcome.
Thanks, Gene. Well, I've been a practitioner here in Rockford for 18 years, and it wasn't until about 5 years ago that I realized I had a significant health problem when I found out I had calcium in my coronary arteries. And that was a rude awakening to me because I've always been a runner and active and that type of thing. But I wasn't very good in nutrition for myself and was doing a lot of the wrong things. And because of that, I began studying all about nutrition, disease prevention, and amazed at what I found that I wasn't trained in this during medical school or residency. And so I'm glad for this opportunity to share what I found because I believe it can impact people's lives. In fact, I believe I'll be able to impact more people's lives through this educational process about nutrition and disease prevention than I have been able to in my practice so far. And I'm very gratified that I've been able to treat many of my friends, relatives, and patients with this, and it's benefited them already in a big way. But as you know, we have a healthcare crisis in this country, that our health is not improving. In fact, it's getting worse. And it relates to some of the things I'm going to talk about today that I think are very important that you can take with you and make a big impact in your life. The number one killer in this country is heart disease and type 2 diabetes, obesity, or other very significant issues and other chronic diseases. These are reversible, and you won't hear about that very much. It's more of you get the diagnosis, you begin treatment. In terms of reversing and preventing, you don't hear much about that. Doctors don't take the time or have the time or the knowledge, perhaps, to explain this to their patients. You start out with the genetic platform. In your genes that pass down to you from your parents that might predispose you to some of these things. But don't lose heart because I believe and have found that you can impact your health much more through proper nutrition and supplementation than you are impacted by your genetic risk factors. So that you can change. You can see we're supersizing our food, French fries, everything's bigger. You go to a restaurant and they give you portions that are huge compared to what they used to give you. It's all part of marketing. And we're eating more of everything. Eating now about 200 pounds more per year than we did before, 18% increase since 1973 to 2000. Only 4% of that increase is protein. The rest of it is fats and carbohydrates, primarily high glycemic carbohydrates, to where our diet now has a glycemic index of over 70. And America's health is declining as a result of that. We were, in 1950, ranked 7th among the top 21 industrialized nations in life expectancy, and now we've fallen all the way to 18 by 1990. We might be lower now. So this is a very significant concern, and really the main difference here is our diet, because not a whole lot else is different when you analyze the situation from an epidemiological standpoint. So what's going on with this? The high glycemic carbohydrates and the diet we eat is leading to increased weight problems and weight issues for women, for men, and especially for adolescents. And this does not bode well for our future. That adolescents basically have quadrupled their rate of obesity, and that is already resulting in a high rate of diabetes among teenagers now. So before, diabetes was a disease that comes on later in life, at least type 2 diabetes, but now we're seeing 18-year-olds coming down with this, and it's quite a tragedy, really, and it's a healthcare crisis that we need to really look at. Take a seat, have more fat. Basically, if teenagers go to these 10 restaurants and they get whatever they want, this is what they're going to order. A lot of calories and a lot of saturated fat. Most of it is saturated fat and trans fats here, which is not good for us. The basis for what I'm talking about, the basis for why the weight is going up and we have so many of these problems relates to the carbohydrate addiction cycle. This term is in Dr. Strand's Releasing Fat book, which I recommend to all of you, that talks about the carbohydrate addiction cycle, which is a fairly new concept in the last 4 years or so, but extremely important. And this is probably the most important slide I'm going to share with you today. Your blood sugar in the morning starts out about 80 or so, and then if you have breakfast, and anything you have out of a box for breakfast is going to be high glycemic. And by high glycemic, I mean that when you take that particular food, your blood sugar goes up rapidly. So it's about the idea of how fast that sugar gets into your bloodstream. So high glycemic foods raise your blood sugar level much quicker than is good for you and much quicker than is natural for you. So basically what it should be is you should have a nice gradual upswing here if you had a normoglycemic meal, but instead we're eating a high glycemic food here in America. It spikes our blood sugar. Insulin is a hormone made by the pancreas that is required in order to get glucose into our cells. It's also required to get excess calories into our fat cells. So insulin is essential, but if you spike your blood sugar too fast, the insulin spikes too far, too fast, correlating with the sugar level, and then you have a sort of a crash, as it were, of your blood sugar down below your baseline here at 80 into a high glycemic state, or hypoglycemic state. In the hypoglycemic state, your body basically goes into an emergency because we have the release of epinephrine, glucagon, and cortisol, which are stress hormones, and also an intense carbohydrate craving sets in because your body is saying you've got to get some sugar or your brain is going to start shutting down, which is true. You can get lack of clarity of thought, fuzziness, and that type of thing. So folks right here, they respond to this by saying, I've got to eat something right now. This can't be wrong if I feel this hungry or this famished for me to eat something. So then about mid-morning, they're looking for the donut in the break room or something, crackers or what have you, to raise this blood sugar back up. And so it's an addiction cycle because it feeds on itself. So up it back goes again, and then down, and then lunch, and then mid-afternoon snack, and then dinner, and then bedtime snack. So this is what's happening, and people don't realize it's happening to them. They don't realize what's going on. I've had some people, when I give this talk, say right away, Doc, I'm carb addicted, I know it, I feel it, you're right, that's me. And so a lot of people see this right away, but not everybody does. But what happens, how this relates to adipose tissue, is that all these spikes here, if you take the area underneath this curve here, 6 times a day or what have you, and then collect all those calories together, this high insulin spike also puts those excess calories into fat, so we start building up what we call visceral fat. And visceral fat is right here. It's inside, it's intertwined in the intestines, and that is what causes serious health problems for us. And I'm going to show you a slide right now where this is the visceral fat I'm talking about, okay, compared to this. So you can see very little visceral fat visible. Sorry for the graphic nature of these slides, but it gets the point across that very little visceral fat, if any, but an awful lot here. And this is the most metabolically active fat. And if you compare the width of the fat here to the width of the fat here, you can see that the differential is not that huge. But when you compare this to that, you can see it's astronomical. And so as we gain excess calories and excess fat from the excess insulin and excess sugar, that it just adds up over the years, and that leads to our health problems. Now, back to the glycemic index. Some folks wonder, well, what is the glycemic index and what kind of foods are good? So this is a general table that shows you things like steamed broccoli, tomatoes, squash, zucchini, vegetables, the USANA shakes I'm going to talk about. These are all low glycemic here. Higher glycemic, potatoes, French fries. The only reason French fries are not 93 like a baked potato is because French fries are deep fried. There's a lot of fat mixed with the French fries and the potato of the French fries, which slows the absorption. So you actually don't spike blood sugar quite as fast with French fries, but of course it's just as bad for you, if not worse, because it's got all that fat on it. So, but you can see white bread and our diet is basically, the American diet is about 70 plus in the glycemic index. We'd like to be 50 and under for most of what we eat to combat and counteract the carbohydrate addiction cycle, to get off of that cycle and begin getting yourself into a net releasing fat metabolic state. And you do that by reducing the glycemic index of your diet. Some sugars, this is why fruits are good, because fruit sugar is only 23. Fruit sugar has a glycemic index of only 23, whereas table sugar is 65. So you can see there's a big difference. So snacking on fruit, salads, and those kind of things are much better than high glycemic snacks. Now, another concept I want to share here is the whole idea connected with losing weight and getting into that releasing fat metabolic state. And if you take the same individual, such as yourself, and you have the equivalent amount of calories coming in from whatever measurement, but basically the same caloric input here in your nutritional channel. If you have a high glycemic diet, you're going to have a shunting effect by the excess insulin. It's going to shunt those calories into fat preferentially against energy. Okay, so you'll have less energy and more fat. Down here with a low glycemic diet, for the same amount of calories, you're going to have greater energy and less fat. So the difference is that you're not spiking your blood sugar, so you're not spiking your insulin, so you're not throwing those extra calories into fat. Instead, you're putting them into energy. So this is a very important concept few people realize, because most people think, well, calories in, calories out. If you take more calories in than you're burning, you'll gain weight. To some degree that is true, but not completely, because here the difference is energy. And what we found with our recommendations, that people say almost 90% plus say, Doc, I've got more energy. And this is exactly why they have more energy. Folks that go on the 5-day high fiber cleanse and they break the carbohydrate addiction cycle in 1 week, they're taking in less calories, but they have a lot more energy because it's being shunted into the energy category where it belongs. Some other metrics here we have on the healthcare crisis in America related to visceral fat accumulating. So this is the body mass index, which is a function of your weight and your height. Okay, so it's not just weight; it's your height and your weight together, creating the body mass index. So as your body mass index increases, so does your risk for type 2 diabetes. And my body mass index is right around in here. And if you're in this, and you're in good shape down in here, but if you start getting up into this, you have exceedingly higher risk, exponentially increased risk. And so glucose levels and weight, you can see again, we talked about elevated insulin. As your weight goes up, your insulin goes up, and your blood sugar goes up. So you start out with the pre-diabetes state, and you move up to full-blown diabetes. And a light switch doesn't go off at this level. I mean, it sounds like it when the doctor says, oh, you're diabetic. Well, something just happened. That's not true. It's been going on for years and years and years.